Hello, my name is Minjun Jang, and I'm a rising senior at the International School of Minnesota. Today, I'll be presenting on the role of health literacy in reducing global health disparities. To share a little bit about myself, I was born and raised in South Korea, but I currently live in Eden Prairie, Minnesota. I'm the co-founder of SOOT, a nonprofit organization that promotes teenage health and wellness. I also founded Global Mindlift, a nonprofit providing free tutoring and cultural exchange opportunities across continents, particularly in underfunded regions. At school, I served as the deputy head of sports in a student life organization where I organized all major sports events, and I was also the secretary of the National Honor Society where I led volunteer initiatives. Let me begin with one question. What would you do if your life depended on understanding a prescription label written in a language you don't speak? You wouldn't know if it contained allergens or any other substances harmful to your health. This is exactly why health literacy is essential to global health. The World Health Organization defines health literacy as representing the personal knowledge and competencies that accumulate through daily activities, social interactions, and across generations. It's the ability to navigate the healthcare system, recognize symptoms, and make safe and informed decisions. Yet, health literacy is often overlooked. It's intangible, hard to measure, and invisible until misinformation spreads. While global health efforts often focus on building hospitals or distributing medication, far less attention is paid to whether people understand how to use those resources properly. In fact, the global average for current health expenditure is less than 10% of GDP. As shown in the graph to the right, the highest spending occurred in 2020, yet even then, only slightly under 11% of global GDP was allocated to healthcare. And within that small fraction, even less is directed toward health education and communication. Why does this matter? Because low health literacy leads to poor health outcomes, including misuse of medications, delayed treatment, misunderstanding chronic disease instructions, and preventable deaths. People with low health literacy are also more likely to use emergency services and be hospitalized, which increases global healthcare costs by an estimated 3 to 5%. In contrast, investing in health literacy can actually reduce long-term costs. Next, health literacy disproportionately affects marginalized populations, including women, youth, rural residents, immigrants, and individuals with limited education. According to public health experts, communication resources are often least available to those who need them most, reinforcing racial, ethnic, and socioeconomic disparities. Many health systems assume that patients understand instructions or have access to services in their own language. But without that, patients cannot advocate for themselves or protect their health effectively. And in times of crisis, such as pandemics or natural disasters, health literacy can be the difference between life and death. Clear communication saves lives, but without it, misinformation spreads, vaccine hesitancy grows, and public health compliance drops, as we saw during the COVID-19 pandemic. Let's take a closer look at two case studies. The first case study is on COVID-19 in the Philippines. During the COVID-19 vaccine rollout, Facebook became a central platform for the spread of misinformation, with conspiracy theories about vaccine safety and side effects. Many Filipinos lack the health literacy skills to evaluate whether the information was accurate. Combined with low public trust in government sources and fears from past vaccine controversies, this led to widespread vaccine hesitancy. Without a national health literacy agenda, the public remained vulnerable to fear-based narratives that undermine public health efforts. The second case study comes from Nigeria, where 41.6% of pregnant women had inadequate maternal health literacy. Women with limited maternal health literacy often struggle to understand antenatal care materials and are less likely to breastfeed immediately after childbirth. As a result, they frequently rely on friends, family, and local health workers for guidance. Low maternal health literacy is strongly associated with poor or delayed health decisions during pregnancy and childbirth, contributing to maternal and newborn mortality. So how do we improve health literacy and reduce these disparities? First, we can develop community-based health education programs. Training local community health workers to deliver culturally appropriate health education improves knowledge and health outcomes, especially in rural and marginalized areas. They serve an important role as health educators and should collaborate with clinical providers to address health issues. Secondly, we can use visual aids and simplify language when communicating essential information about healthcare. Replacing jargons with pictures, symbols, and simple and clear language in health materials enhances understanding among low literacy populations. Lastly, we can promote policies and funding for health literacy. Governments and global health organizations must prioritize health literacy and public health planning. Funding these initiatives reduces system-wide costs and improves health equity. To summarize, low health literacy leads to preventable deaths, poor health outcomes, and wider health disparities. Despite its importance, health literacy receives minimal funding and attention. But with community education, digital tools, and policy reforms, we can begin to close these gaps. It's important to understand that our health systems often focus on accessibility, but access alone is not enough. You need to have literacy skills in order to truly take care of your health. Literacy is a human right. It's the foundation for safety, informed decision-making, and health equity. Let me leave you with the question once more. What if your life depended on a prescription label written in a language you couldn't understand? Now imagine that's a reality for billions. What will it take for governments, educators, and advocates to finally treat health literacy as life-saving care? Before we end, here are my references. And I would like to thank the Johns Hopkins Global Health Leaders Conference for the opportunity to present a topic that I deeply care about. Thank you so much for listening to this presentation, and if you have any questions or would like to connect, feel free to contact me via email or LinkedIn. Once again, thank you so much for listening.